On today, I am excited because we have one of our committee members, one of our great friends, Morgan McCall, is with us today. And Morgan is going to talk with us about compassion fatigue, prevention, and self-care.
So I want to start with just kind of a reminder, here to everyone, how valuable the work is that you're doing. And a little quote from former First Lady, Miss Rosalind Carter. She said, "Caregiving is universal. There are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers." And I believe that everyone in this virtual room has chosen caregiving in some fashion as your professional endeavor in the world. And even if you're not doing direct patient care, you're caring for or serving those who do. Because the CDC has outlined that healthcare workers are facing what they describe as a severe mental health crisis. That's what we're in right now. Harassment, burnout, anxiety, depression rates are higher than they've ever been before, because exposure to daily human suffering takes an immense toll on our bodies, our minds, and our souls. 46% of all healthcare workers and 62% of nurses report burnout. Last year, 72,000 physicians left the profession unexpectedly. 34% of nurses say that they plan to leave the profession not related to retirement in the next year. But what exactly are you feeling? These are the 3 most common types of stress that healthcare workers encounter: our moral distress, our burnout, and our compassion fatigue. Moral distress, when one knows to do the right thing, but external constraints, conflicts, dilemmas, or uncertainty make it nearly impossible to pursue the right course of action. This is really, really common for healthcare workers who are caring for critically ill patients. Addressing moral distress is primarily addressed around the awareness of the fact that you feel it, number one, talking about it, whether that's individually with a trusted mentor or a colleague, or in a group, such as through resilience rounds, receiving education, which you're doing today, kudos to you, right? Or providing training, right, to your team on this topic. And then certainly, if you're in a position of authority, to implement practices or policies that help prevent it. Our second type of distress, burnout, right? The World Health Organization actually put out an ICD-10 recognizing burnout as an occupational phenomenon. It's Z73. Z73. It's an actual ICD-10. So this is a syndrome that is conceptualized as resulting from chronic workplace stress that has not been successfully managed. So how do you know that you're experiencing burnout? You may have feelings of energy depletion or exhaustion, increased mental distance from one's job, negative or cynical feelings related to your job, hate to go to work, right? Hate to get there, mad at anyone who talks to you, and then reduced efficacy and productivity. And then we're going to jump to our last stressor or level of distress. And this is where we're going to spend the majority of our time, is on compassion fatigue. And what I'll say is that I think it's important to recognize, because a lot of times you hear, "I'm so burnt out." And compassion fatigue is different from burnout in that you may feel sad or numb versus displeased, right? And I'm sure that you can see how all of these 3 types of distress are really interrelated and can yield to the other type of stress in many ways. So we would define this as the physical, mental, and emotional weariness resulting from prolonged exposure to caring for those in significant pain or emotional distress. When people feel excited and pleased by the work that they do, helping others, right? And finding meaning in your work, seeing the value that you bring to the world, joy in your role, that would be compassion satisfaction. And that's where we want to be. How do we get from from compassion satisfaction to compassion fatigue? It starts with exposure to suffering, right? When a new patient arrives, they're often in pain, they're experiencing fear, they're seeking reassurance that they're going to be okay, right? And so what is the natural thing that we do? We give empathy, right? We have an empathetic response. We show concern. Again, we talked about, we enter this field that we're in because we care about people. We want to support their health, right? When they're exposed to pain and fear, we respond with empathy. This is natural concern about the well-being of the patient, right? And if everything goes well, then we get to enjoy the feeling that we truly made a difference, right? That we were able to help them live a healthier existence. What happens when things don't go well, right? So when we have that prolonged exposure to suffering or a long-term exposure, it's easy to kind of be feeling this residual compassion stress, right? And when we leave that unattended, right, then these feelings can manifest as those traumatic memories, right? And that starts to affect the physical, the emotional, the cognitive, and even the behavioral health, right, of all of you. And when that happens, we become detached, where they're not really able to use their empathetic abilities anymore when they're caring for their patients. I've heard so many healthcare workers that will say, well, my heart, I don't even respond anymore. My heart is so hard, and they feel incapable of feeling emotion. And when that's the case, compassion fatigue has really fully taken hold. If you do answer yes to these, keep a little tally on your hand, okay? Do you find it difficult to feel hopeful on a regular basis? Does the stress of your patients' lives affect you personally? Do you find it difficult to process and recover from the daily trauma of your job? Are you left feeling that no matter what you do for your patients, you aren't making a meaningful impact? Do you find it difficult to feel settled about your unfinished personal business? Do you ever find yourself withdrawing from family or friends? If you answered yes to 5 or more of these questions, consider talking to someone about what you've been feeling, because you may be at risk for compassion fatigue. Know that there's still opportunity for some prevention, right? Know that putting yourself first isn't selfish. Create emotional boundaries, right? Find your support network, because there are a lot of other people who understand your daily challenges and can help you recharge. At the core of an effective work-life harmony definition are 2 key everyday concepts that are really relevant to each of us, right? And it's daily achievement and enjoyment. So achievement and enjoyment are on the front and the back of the coin of value in life. And if you focus on that every day, then it helps you avoid sort of the as soon as trap. So what are our primary concepts here to achieve and enjoy? So first, we're going to say, stop searching for balance. There is no such thing as, when we say work-life balance, it's a very common term. But again, let's merge that to that work-life harmony. Be present. If you're at work, be at work, right? Focus on the activity at hand. When you're with your family, be with your family. Leave work matters out of your mind. Manage your time well. Has anybody ever heard the term failing to plan is planning to fail? Stay active. Baby steps. You don't have to be in the gym every day, okay, guys? But taking a quick walk around your unit or a quick walk to the mailbox if you work from home, honestly, it makes a big difference. And then rest. You got to sleep at night, guys. When you don't get regular sleep, Your brain's in a fog. You don't make new memories. It weakens your immune system. It slows down your brain's ability to process during the day. Make sure you're getting adequate rest. Another really good self-care item is setting healthy professional boundaries. Where do you draw your line in the sand? Because boundaries define limits, and this protects you. And each of us has to take responsibility for how we allow other people to treat us. You teach them how to do that, you know. So, looking at social relationships versus professional relationships. Social's any non-professional relationship that's developed and maintained in your personal life. And professional relationships are time limited, right? And focused on providing specific services for another, typically for a fee, whether that's a direct fee or whether that's from their insurance, right? This is directed towards a goal. And once the goal is met, that relationship ends. It is a responsibility of the professional to maintain boundaries, right? Keeping things professional guides positive relationships with our patients and our colleagues. So it's important to utilize your skills within your scope of practice, delegate when appropriate, say no when appropriate. Don't be afraid to do that. Team health. Positive work environment is key, right? As we think about prevention of our distress types, right? Our moral distress, our burnout, our compassion fatigue. We spend just as much time with our coworkers as we do with our family in many instances. So let's make it good, right? Work out conflict when it first arises, build each other up, support one another, do team building. So if a team is healthy, they have clear roles with mutual purpose, shared team values, established lines of accountability, strong leadership, established team health activities, demonstrated respect of individuals and the team, clearly stated performance expectations, open communication, and folks that are engaged, people that speak up. So no matter what kind of role you're in, you have the opportunity to have this kind of impact on your team health. Leadership is not a position, right? Leadership is the actions that you take as an individual that make you a leader. Resilience would be described as the ability to recover and recuperate quickly from a difficult or challenging situation. In order to build resilience, we have to be able to take and stay in control of our hearts, our minds, and our bodies.